Family Policy Alliance. And today we're talking about abortion. I want to preface this conversation by saying that this is a topic that the social media algorithms do not like. So if you're watching this and you are encouraged or surprised by some of the things you're hearing and want to help get the word out, we would really value you sharing this because that is the way that this message will get out. The social media algorithms are not going to be working in our favor on this topic. But with that preface, we are talking about abortion today. And I have two really wonderful qualified guests to talk with us. The first one is Dr. Christina Francis. She's an OBGYN with a passion for the pro-life cause. And she's the chairman of the board at the American Association of Pro-Life OBGYN. So we're really excited to have her. And then we also have with us Erik Baptist, who is with Alliance Defending Freedom. And they currently have a lawsuit going on in the area of chemical abortion, which is what we'll be talking about today. So I'm excited to talk with you both about this, but I want to jump straight in and talk about chemical abortion because I think this is something that not a lot of people are familiar with. So Dr. Francis, I'm going to direct this one at you. Can you just describe what we mean by chemical abortion, what that process actually looks like?
Yeah, absolutely. Well, and I'll start by saying that there's a recent shift in titles. So I actually am getting ready to take over as CEO at Applog, and I know we're going to talk about Applog a little bit more later in this conversation. But yeah, I think it's important that all of us understand exactly what chemical abortion is, because there's a lot of confusion, I think, out there. A lot of people think maybe it's the same thing as Plan B or the morning after pill, but it actually is a very specific 2-drug regimen that was approved in the US by the FDA in the year 2000. And like I said, it involves 2 medications. The first one is something called mifepristone, and that's a pill that women used to have to take in the presence of the abortion provider. Now, because of changes that we'll discuss by the FDA, they can take that at home. But that first medication works by blocking the action of progesterone, which is a key hormone early in pregnancy that really allows that early baby to be able to develop as he or she should. So it allows development of good vascular connections so that the nutrients and the oxygen that preborn child needs can get to him or her. So mifepristone works by binding to the receptors for progesterone and blocking progesterone's ability to do what it needs to do. Most times that's the drug that actually leads to the death of that preborn child. That drug is followed up 24 to 48 hours later by a drug called misoprostol. Now, some people watching this may have heard of misoprostol or Cytotec. It's used for term labor inductions as well. It can be used for miscarriage management, but in this case, it's used to induce labor, essentially to make the woman's uterus contract so that she then expels the baby, whether that baby already be passed away or whether the baby actually is delivered alive and then passes away. And it leads to a lot of pain, very heavy bleeding, and some potential complications that I think we'll also talk about.
Yeah, and I'd love for you to just get into this because I think when people think about abortion, naturally what they're thinking about is going to be surgical abortion, and so they're imagining the images that they've probably seen by now of what goes on in the surgical abortion, and of course that's gruesome and horrific. But what we're talking about here has its own set of risks. So what's involved there for the woman, especially?
Yeah, absolutely. Unfortunately, these dangerous drugs are being sold to women as being sort of an easier alternative than a surgical abortion. I think people think, oh, it's just medication that you would take, it's not a surgery. But actually, nothing could be further from the truth. And now, these kinds of abortions, according to Guttmacher's own data, account for more than 50% of abortions in this country. And that number is only increasing. That number was from, I believe, 2020. So, we expect that by now it's probably closer to 60, maybe above 60%. And what we see when we look at good studies that do a good job collecting data on the complication rates, what we see is that these drugs carry a 4 times higher complication rate than do surgical abortions. And that's, dealing with physical complications. So the most common complications would be hemorrhage or really heavy, severe bleeding that might necessitate a blood transfusion. It involves incomplete abortions where tissue is still in the woman's uterus and she has to have a surgery then to complete her abortion. That can also lead to infection. And we know that there are certain kinds of infections that are actually tied to that first drug, the mifepristone, that first pill that the woman takes. that causes an increased risk of a certain type of bacterial infection that actually causes sort of an atypical sepsis picture or an atypical picture of a life-threatening infection that can be harder to diagnose, increase in a woman's risk of dying. And in fact, people might have heard of a young woman, unfortunately, recently in Canada that passed away from this very kind of infection after taking these abortion drugs. So there are significant physical complications that are tied to these drugs. But as you referenced a little bit, there's also sort of these mental and emotional complications that are tied to these drugs. Women oftentimes are not told to expect that they are going to see their baby when they have this kind of abortion. And I think one of the real tragedies about chemical abortion is that these are not occurring in operating rooms, in abortion facilities. These are occurring in women's homes. They're occurring in women's dorm rooms, their dorm bathrooms, and they are seeing their babies pass from them. And so the reality, I think, of what is going on definitely hits them in that moment. And doctors that we work with, as well as organizations that we work with, are receiving calls very frequently from women who were not prepared for that, women who were told to just flush their babies down the toilet. But when they see their baby, they see the evidence of the humanity of their child. They just can't do that. And this is causing a lot of emotional trauma for women that are going through these kind of abortions.
I think that's so important to talk about the emotional aspect of that too, because I think when people think about a pill again, or a series of pills rather, they think of what happens when they take ibuprofen or something. There's nothing that they see. There's nothing else that's happening, but there actually is that component here, because you are actually expelling your baby.
Right.
And so I appreciate you drawing our attention to that. Kind of an aspect of this, you were talking about how women are doing this at home. It's usually just in their toilet. And of course, ever since COVID, I think this has been especially fast-tracked to have less and less physician involvement. So not only is the actual abortion taking place at your home, but physicians are less and less involved. So can you walk us through a little bit of what's happened over the last couple of years in that regard, and how that has affected things like informed consent?
Yeah, absolutely. This is a real problem. And it's actually one of the aspects of our lawsuit against the FDA, which I know we're going to talk about in a little bit, is that there has been this push by the abortion industry for several years, actually, to remove medical supervision from this process. So we know that these drugs, at their baseline, even with medical supervision, are very dangerous to women and girls. Certainly, they're dangerous to the preborn children whose lives are ended through this process. But now the FDA has removed safeguards over the use of this drug to allow it to be dispensed without a woman being seen in person. So there are groups like Aid Access that have been trying to do this for years. But you're right, with the COVID pandemic, because women weren't going in to be seen by their physicians, unfortunately, the American College of OBGYNs, who claims to be the premier organization for OBGYNs across the country, actually sued the FDA in 2020 over the restriction that required an in-person visit, saying that it was too onerous, that women needed to be able to obtain these drugs from home. And unfortunately, a federal judge granted their request. And so we saw back in 2020 women starting to be able to obtain these pills through multiple different websites, some of which had a telemedicine visit with a physician, some of which just involved basically filling out a form. Now, the danger in this, and this is not being said by the abortion industry or their allies within the medical profession, but the dangers in this are multiple. First of all, we know that the risks of these drugs increase significantly the farther along in pregnancy a woman is. So it's currently approved by the FDA up through 10 weeks gestation. But how are we supposed to know when a woman is just filling out a form online whether or not she's even correct about how far along she is? In fact, that same group, the American College of OBGYNs, in one of their other documents says that up to 50% of women will be wrong about their gestational age based just on their last menstrual period, and that any pregnancy that is not dated by an ultrasound should be considered suboptimally dated, meaning we don't exactly know how far along she is. And this is really important, like I said, because even at 13 weeks, just 3 weeks beyond where the FDA has approved this drug, her risk of needing an emergency surgical completion of her abortion goes from 1 in 8 to 1 in 3. So how far along in pregnancy she is makes a huge difference as for what her risk of complications are. The other thing that an in-person visit is required for is we need to make sure before these drugs are given that the pregnancy is in fact inside of her uterus where it should be, and not an ectopic pregnancy or pregnancy outside of the uterus. This occurs in 1 in 50 pregnancies. So this is not a rare condition. And it's a life-threatening condition for the woman, especially if it's not diagnosed. And, the real danger with chemical abortions and missing an ectopic pregnancy is that their symptoms are essentially identical: vaginal bleeding and abdominal pain. And so if a woman has taken these drugs, she thinks that her bleeding and her pain is just from the abortion. She's been told that that's normal, just to expect that and stay at home. She's wasting precious time that could actually mean the difference between life and death for her in not seeking medical care for her ectopic pregnancy. There's multiple other health concerns with a woman not being seen in person, including the really lack of ability to screen for coercion or trafficking. We know that many sex trafficking victims have forced abortions, and this provision of these drugs online with no in-person visit is a gift to abusers. It's a gift to traffickers that they don't even have to show up to a medical office with their victims to get these drugs. They can order them, in mass if they want to, and have a stockpile of them to use for their victims. So this really is just complete negligence of the care of women to be dispensing these without medical supervision.
Oh, that's awful. And I appreciate you bringing up the concerns about women who are being coerced into this. I think it's another aspect of this that people don't think about, especially again when they're thinking it's just pills. It's easy to imagine someone dragging a woman into an abortion clinic to get a surgical abortion, but you don't think about that aspect when someone's just ordering pills online. And of course, it's now getting even easier to get those pills because of something the FDA recently did. Do you want to bring our audience up to speed on that?
Sure. So, as I said, it kind of started when ACOG sued the FDA in 2020 to get that in-person requirement removed. And then at the end of 2021, December, the FDA made the lifting of those safeguards permanent. So they said that women did not have to be seen in person before receiving these drugs, that they could receive them through the mail, they could order them online, maybe through a telemedicine visit. But again, that's not even happening all of the time. And they continue to not collect or require the reporting of complications. The only complication that they require the reporting of is a maternal death from these drugs. And so the FDA has lifted most of these safeguards. The only thing that remains is that in order to dispense these medications, supposedly you have to be a certified prescriber through the manufacturer. But again, there are dozens and dozens of websites where women can obtain these drugs, either from pharmacies here in the US or sometimes they come from overseas. And, so again, the FDA has just neglected its duty. And I know Erik can talk later to what exactly the FDA has been tasked with doing by Congress. But essentially their duty is to protect the American public from dangerous drugs. And they have completely abandoned that duty when it comes to this drug. And we know that women and girls across this country are being harmed day in and day out by these dangerous drugs. And that's why we are involved in this lawsuit.
Yeah. So Erik, I'm going to turn it over to you now to just talk to us about what is this lawsuit? Why are you all involved, and what does that look like?
As Dr. Francis mentioned, the FDA has a legal obligation to protect the American public from all dangerous drugs, but have failed America's women and girls by approving dangerous chemical abortion drugs, and then repeatedly failed them by taking away basic protections for those who take these chemical abortion drugs. Therefore, we are suing the FDA for all its actions, both to approve chemical abortion drugs and then take away those protections. The FDA, in order to approve chemical abortion drugs, the agency needed to define and call pregnancy an illness. It also needed to explain that chemical abortion drugs provide a meaningful therapeutic benefit to women and girls who take those drugs. Both are patently false statements. And that is one of the many legal infirmities associated with the FDA's actions on chemical abortion drugs. The second is that the FDA is legally required by Congress to have substantial evidence, adequate testing, and sufficient information demonstrating and showing the safety of these drugs as directed under the label. Over the course of 2 decades, the FDA has not a single study that has ever evaluated the safety of these drugs as directed on the label. Every study contains precautions and protections for women that's not afforded to the women in the real world, such as an ultrasound to determine gestational age, identify the ectopic pregnancies, as Dr. Francis noted, and then at the end of a chemical abortion to determine whether she has any fetal parts remaining or other pregnancy tissue that could lead to life-threatening complications. None of that's required in the regimen, but those are the studies that purportedly demonstrate the safety of these drugs according to the FDA. And finally, the FDA has had a legal obligation since it approved these drugs to study the safety and effectiveness of these drugs on pediatric populations. So here they were supposed to require studies that reviewed and analyzed whether these drugs have any some type of impact on girls, teenage girls who are going through reproductive development, and whether it has any long-term or short-term impact on them. We simply do not know because the FDA has not conducted and required those legally obligated studies. And so we are taking the FDA to court because the FDA has refused over the last 2 decades to do anything about it, to follow the law and to follow the science.
Wow. I mean, just the list of things that you gave there that the FDA has failed on just time after time after time. I think it's really concerning, and commend you guys for leading this lawsuit. Where are you all at in the process, just to give some perspective for our audience?
Yeah, when we filed our lawsuit in November, we also filed a motion asking for expedited review of our claims. And so we're almost fully briefed on this. We're going to file our last brief this Friday. And then, as the court said, this will complete the briefing, and there may be a hearing and then a decision shortly thereafter. So we're not sure of the schedule yet, but we're almost to the end of the briefing schedule, and we're looking forward to expedited consideration of our claims.
That's great, and so important. Every minute saves could be the difference between life and death. So thank you all for doing that. Dr. Francis, I want to talk to you a little bit about the work that you're doing too. So in addition to Alliance Defending Freedom, you all have this really wonderful lawsuit that you're leading. Dr. Francis, you are the upcoming CEO of the American Associations of ProLife OBGYNs. I can say this. APLOG. So can you just talk a little bit about what APLOG does, and just tell us about your organization?
Yeah, absolutely. And no worries. Our full name is a mouthful. That's why we go by APLOG. So it's much easier. So we are a professional medical organization consisting of over 7,000 medical professionals, mostly OBGYNs, but we also include many other women's healthcare professionals. So midwives and nurses, family medicine physicians, mental health professionals who desire to practice medicine from a life-affirming standpoint. We're actually the largest professional medical organization for pro-life medical professionals in the world. And we are celebrating our 50th anniversary this year, which is really exciting. We were actually formed as a special interest group within ACOG, the American College of OBGYNs, in 1973 in response to the Roe decision, because the leadership of ACOG at the time had submitted a pro-abortion amicus brief in the Roe case, which really was incongruent with how most of their members felt. And so there were several pro-life members within ACOG who recognized sort of the pro-abortion direction that the leadership was going, and they formed a pro-life special interest group, which was APLOG, within ACOG. And we quickly became the largest special interest group within ACOG and remained that way until 2013, when ACOG dissolved all special interest groups. And then that's when we became our own separate organization. And since 2013, we have more than tripled our membership. And I think even now we're seeing really exponential growth. And I think the reason for that there are many reasons for that. One is in response, I think, to what we see happening in the medical profession, which is, more of the sort of quote unquote mainstream medical organizations becoming pro-abortion and ignoring the medical evidence that exists that shows that abortion is harmful for both of our patients. As OBGYNs, we care for 2 patients at once. Certainly abortion ends the life of my fetal patient, but also significantly harms my maternal patient. And it's not good healthcare for my patients. And I think a lot of physicians are saying, enough is enough. We need to be offering our patients excellent healthcare and fully informed consent. But also, I just want to make people aware of the pressures that pro-life medical professionals are under right now, especially those in training, but also those in practice. So after the Dobbs decision came out in June, the American Board of OBGYNs, who gives us our board certification, which is what allows me to be able to practice in the hospital that I practice in, they came out with a statement saying that if any board certified OBGYNs were caught spreading mis or disinformation about abortion, that we could have our board certification revoked. So our livelihood is under threat right now because we desire to speak the truth according to the medical evidence about the effects that abortion has on our patients. So one thing I would say to anybody who's watching this podcast is, if you see a physician who's pro-life, please encourage them. They probably feel very isolated and alone and under pressure. And so please just encourage them that you appreciate the fact that they are delivering life-affirming, evidence-based healthcare to their patients.
Well, and I have a follow-up question to that, which is just a practical one. I'm thinking about this as, a woman. I'm at an age where a lot of my friends are having kids right now, and they're seeking out their OBGYNs. How important is it for a woman, A, to have a pro-life OBGYN, but B, if she doesn't have that access or doesn't know if her OB is pro-life, are there certain questions that she can ask, or any advice there?
Yeah, that's a great question. So I'll start with the first part. I think it's definitely very important to see a pro-life physician. And the reason for that is because you want to know that the physician that you're seeing, if you're facing a pregnancy complication or your child is facing an adverse diagnosis, you want to know that you're seeing a physician who is going to fight for both of you and provide you with the most excellent healthcare that we possibly can. Now, there are certainly situations in which we can't save that child because of, maybe a prenatal diagnosis, or maybe mom develops a complication of her pregnancy prior to the point where that child can survive outside of her. But even in those situations, we can still treat both patients, both our pregnant woman and that fetal patient. We can treat both of them with dignity and respect. And you want to know that your physician is going to do that. And, I think a lot of physicians, even those who wouldn't claim to be pro-life, are approaching medicine from that standpoint. And so they know inherently that that's what we entered this profession to do. And in fact, I think that's why the vast majority of OBGYNs, we know that more than 90% of OBGYNs do not perform abortions. So for the vast majority of women who are seeking out an OBGYN, their OBGYN is probably not going to perform abortions. But I think it's perfectly reasonable, especially if it's something that's important to you, that you see a pro-life physician, that you ask a new physician, do you perform or recommend abortions, especially on an elective basis, because that might give you some crucial information and hopefully open up good lines of communication to be able to have a good conversation with your physician. If someone is looking for a pro-life physician, they can go actually to our website, which is aaplog.org. And we do have a public directory there. You can search by your state and look for pro-life physicians that are APLOG members in your area. I will say that there are certain areas of the country where it'll look like we don't have any members there. Mostly that's because our physicians in that area of the country, again, are under immense pressure that if they list themselves publicly, they might face blowback in their workplace. And so don't be discouraged. You can always reach out to us. If you can't find a pro-life physician in your area, we'll try and get you connected if we can. But it definitely is something, it's one of the most visited areas of our website. And it's one of the most common calls that we get at APLOG are women looking for a pro-life physician. So we know that there are a lot of women out there that are looking to see a doctor who's going to affirm their life and the life of their child.
That's outstanding. And I love that you all have that. I'll definitely be sending friends that way. My last question for you is also a more practical one. And it's two parts. So there's a lot of people in our audience. I'm sure there are people in our audience who have had abortions and who are listening to this with regret and wondering what they could have done differently. There's probably another group in our audience who maybe male or female, and they have friends in their lives or family members who are considering abortions or considering whether they would ever have an abortion. What would be your encouragement to each of those two groups of people? So the women who've had abortions and the people who are counseling friends.
Yeah, absolutely. Well, I always assume when I'm speaking to any group of any kind of size that there's someone there who has abortion in their past or who's been impacted by abortion, because we know that it is actually very common. And the first thing that I would say is that none of this was meant to condemn you. In fact, I think it's very probable that you found yourself in a very difficult circumstance that you just couldn't see another way out of. And most likely, knowing what I know, you probably didn't receive the amount of counseling that you needed. So, what I would say is that there is hope and there is healing for you. I would encourage you to seek out one of many post abortion counseling ministries. I'm sure that Family Policy Alliance could get you connected. You could come to our website, we could get you connected. You need to talk with other women who understand what you're going through. And for men who have participated in an abortion decision in the past, I think they're often overlooked. And I know that a lot of men really struggle with regret, with depression, with anxiety over that past involvement in an abortion. And so there are actually post abortion ministries for men as well that can help you through that healing process. This is something that you can forgive yourself for. And I am so, so sorry that you had to go through what you went through, simply because probably you just didn't have the support and the resources that you needed. What I would say to people who have, loved ones or friends in their lives that might be considering abortion is, please, please don't be afraid to talk to them. Help them find out, what abortion really is, what sort of complications might occur, what it might mean for their future. When I was now I work as a hospitalist, so I just see patients in the hospital. But when I was still seeing patients in the office, and I would have a woman come in and see me, and she would tell me that she was thinking about abortion, the very first thing that I would say to her is, can you tell me why you think that this is the right option for you? Or can you tell me why you feel like this is the only option for you? That's a very revealing question. And it doesn't, reveal where I stand on abortion, which I think is important when you're opening up that conversation. But it's very revealing, because most times what they would say to me is that they simply didn't have the support that they needed or the resources that they needed to be able to take care of that child. Or maybe somebody was pressuring them into that decision, a boyfriend, a spouse, a parent, a grandparent. And so it really then, I think, opens up lines of communication to be able to say, if it's coercion, that's not okay. It's never okay for somebody to pressure you into a decision like that. Or if it's a lack of resources, why would we want someone to make a decision that, one, we know is going to be a major decision in their life, two, we know has a very high risk of having either physical or mental complications down the road? At the very least, most women are going to live with some amount of regret for the rest of their life. Why would we want them to make a decision like that simply because they didn't feel supported? An abortion doesn't change the circumstances that they find themselves in. It just puts a Band-Aid on it for a little while. And that's actually why the studies that look at how women feel after they've had an abortion show that initially many of them feel a sense of relief because that moment of crisis has passed. But if you follow them out for several years, what you find is that relief oftentimes goes away, and then they start regretting their decision. And so, what we really want to do is, as those of us who want to support women, want to support their children, want to empower women and help bring them out of those circumstances that they find themselves in, what we want to do is offer them hope, offer them support and love, and let them know that abortion is not the only option for them. And in fact, really is not going to benefit them in any way. But in order to do that, we need to stand alongside of them, not just while they, change their minds about their abortion decision, but through their pregnancies and far beyond as well.
Thank you for saying all of that. I think it's a good word. And I get the blessing of being here at an openly Christian organization where, as you were talking, I kept thinking for anyone in the audience who's gone through an abortion, or maybe this is triggering something else that's been on your mind. The gospel is for you, and Christ is for you. And here at Family Policy Alliance, we firmly believe that. So I hope you are encouraged with that. Dr. Francis, Erik, thank you so much for joining us and for shedding light on a really important and I think under-discussed topic in the pro-life arena. We are so grateful for the work that both of you all are doing, and I hope to our audience that you get involved with both of these outstanding groups, Alliance Defending Freedom Aplog. I'm not going to try to say the full name again, but we'll have the links in the comments or in the show notes if you're listening to the podcast version of this. And by the way, if you are following Family Policy Alliance and you're saying, how can I make just a difference right now? We were talking earlier about how the FDA has been recently allowing the abortion pills to actually be dispensed at your local pharmacy. We have an action alert. We'll again drop the link in the comments and in the show notes. And you can send a note to big pharmacies letting them know that you don't want them to be dispensing the abortion pills. And that's a way you can make your voice heard right here, right now. Thank you so much to our guests and to our audience. We'll see you next time.